I seek for your indulgence on that. Other than that, we all acknowledge that today, 25th April, is World Malaria Day, under the theme Harnessing Innovation to Reduce Malaria Disease Burden and Save Lives. And on that account, one of the key things being the pharmaceutical space, as Africa Pharmaceutical Network and HOPAC within the pharmacy space, the key thing for us was to look at what are our key touch points in terms of delivering care to our communities. And there's a continuing conversation and engagement towards improving access to care, and especially within the community pharmacies. And we know most of the care services, for example, when you're sick, the first point of contact with the healthcare system is normally at the community level, where they come to community pharmacies. So the question is, how do we make community pharmacies be key partners in delivery of healthcare services? And in this case, with a focus on malaria, as we are marking World Malaria Day. So on that account, the first session today will be led by Dr. Sultani Matendechero, which will be key on community engagement, vector control, social mobilization, and partly on diagnosis. And that would be the key focus. So just to give a brief about Africa Pharmaceutical Network, this is a network that brings together pharmacy professionals, stakeholders, and organizations in the African pharmaceutical sector. And the focus is on knowledge sharing, capacity building, policy shaping, and nurturing innovative ideas that can help us realize the aspirations to ensure there's reliable access to safe, effective, and quality healthcare services for the African population. And the background of that is looking at the challenges that we all have in the pharmaceutical industry in Africa. We know the limited pharmaceutical manufacturing capacity, and there's a continental move towards bolstering local pharmaceutical manufacturing. You look at it from Pharmaceutical Manufacturing Plan for Africa, the East Africa Pharmaceutical Manufacturing Plan, and all those different plans that are coming up to ensure that we have a robust pharmaceutical industry in Africa. Those are key drivers. Then the other bit was we have segregated continental pharmaceutical industry with operations ranging from every other aspect, from regulation, supply chain, pharmaceutical care, all of them working separately, but then we are never creating a system that can actually drive the wheel. And to be able to drive that wheel, then we need to have a common network and a common driving force behind that. Then finally, a common platform to drive industry-led continental plans for evolution of the pharmaceutical industry. So the option was having Africa Pharmaceutical Network to be that vehicle that can bring us together to shape the course of what we wish for the pharmaceutical industry and the pharmaceutical sector generally across Africa. And therefore, we are working with the individuals who are like-minded and hoping that we can shape the future of the continent in the pharmaceutical sector. And the aim, foster continental knowledge sharing, as I mentioned, best practices, stimulate innovation, champion for a responsive and market-driven policy landscape. And that links to the session that we'll be having on the last day of the discussion, where we'll be key on what is the policy imperative to engage community pharmacies in malaria care. Then finally, to stimulate investment, because we know for all these driving factors in terms of improving access to care, there is need for investment, that in terms of financial resources and every other kind of resource that would be needed to make that a reality. So in that case, how do we do that? And those are the key things that we want to do. And how do we do it? Stakeholder engagement forums, where we engage with different people. And normally we have forums that we normally just have discussion from different speakers. Then we have capacity building programs. This is one of them, where we have key speakers sharing insights on what they think can be enablers towards this aspiration that we have. And this is going to help us as stakeholders, as industry professionals, to actually learn and adopt some of these skills. Then finally, research, market intelligence, and policy advocacy. So on that account, I'll hand it over to the moderator for the session today. Kelly, you can take over from here. Thank you.
Thank you, Debbie. Welcome everyone to this session. I hope that it's going to be educative and eye-opening, and it's going to make pharmacy practice better. So like Debbie said, today's session will be on community engagement for vector control, social mobilization, and diagnosis of malaria. So basically, Dr. Matendechere will take us through the public health sector and the policies that have been put in place to engage the community in controlling the spread of malaria, how the society and the community in general have been mobilized to identify signs of malaria and when they can seek medical care and diagnosis of malaria. So without further ado, I'll welcome Dr. Sultani Matendechero, who's the head of National Public Health Institute, to take us through the session. And then after that, we'll have a question and answer section where each of your questions will be answered. If you have any comments, you're free to write them in the chat box. So welcome.
All right, thank you very much. Sorry, I'm joining in from one of our meeting rooms. I've just had to excuse myself.
No worries.
From a meeting that's going on and on and on. Yeah, thank you very much for this opportunity. I could see you are really struggling with my name, but towards the end, you were able to get it right. So congratulations on that.
Thank you.
Yeah, so it's always a pleasure to engage with colleagues, just to be able to talk about our profession. And especially, I think for me, the most exciting thing is, to be able to engage in terms of the evolution, of our profession. How are we moving it forward? Because, in life, the only constant thing that we will always be facing is change. So we have to ensure that we are changing, with the times, so that we can remain relevant. Now, I was asked to talk about community engagement for vector control, social mobilization and diagnosis of malaria in particular. And I just put together, I scribbled down some guiding notes, just so that I can be able to use these to maybe walk us through that discussion. But eventually we will be able to now just cycle back and have some one-on-one, so that we can be able to discuss this a bit better. So as I speak, I'm trying to see if I can share my screen. I don't know if I'll manage, because I'm not very good when it comes to technology. I think I'm somewhere close to being able to manage. So I don't know if you can see, my screen.
Yes, you can.
Yes, you can.
Good. Yeah, so we are just going to have a very quick discussion around, as pharmacists, I believe that we are actually discussing around our profession as pharmacists, just to be able to see what is it we can be able to do, especially when we are looking at malaria control. And, when it comes to quite a number of the other interventions that we must undertake as members of the healthcare professional team, just to ensure that we are having an effective intervention against malaria. So I'll try to move a bit faster in the interest of time, so that we can have ample time just to discuss around some of these areas that we are looking at. So to start off, I want to start from the known to the unknown. And probably just to also quickly say that personally, today, what I do is traditionally unrelated to pharmacy practice. Today, I am in public health, deeply in public health management. And this is something that I've done for a very long time, which we would say is unrelated to pharmacy. But then when you look at me as a member of the healthcare provision team, then you discover that it is not something that is out of the scope. So in that light, then I would want to just speak about some of the things we can be able to do, even if, quote unquote, we are looking at them as if they are not mainstream pharmacy. But, by virtue of the fact that we have a medical background, then we should be able to do this. Now, as a disclaimer, I just want to say that let us not forget, and I think this is something that we need to correct, in our area of operation, there is still so much that we need to do in order to operationalize our key role as pharmacists. So maybe just to quickly run us through, and I've given you some time to just read through my slide. We have to keep on remembering that as pharmacists, our main role is to ensure that the medicines are there in the first place. Our role just circulates around medicines. Anything that talks of medicines, then we must really have a pharmacist there, because that is our mainstay. So when we talk of manufacturing, that is our area. We really have to make sure the medicines are being manufactured. We have to also look at, because these are very specialized supplies, we cannot just handle them like any other. They are not loaves of bread, neither are they sweets. So issues around distribution has to be done in a very highly professional way. And that is where our difference comes in, the way we professionalize, the way we handle these highly sensitive kind of products. Things like warehousing. How do we ensure that warehousing is done in a correct manner? And in my next slide, we'll be able to quickly just recap on the need for us to be able to pay special attention to these issues around forecasting and quantification, and of course the ripple effect of poor forecasting and quantification, where on the one side we are looking at stockouts, and on the other side we are looking at expiries and wastage. Of course, issues around procurement, that is our mainstay. And we really have to also differentiate the fact that as pharmacists, we are much better placed to be able to, procure these medicines better. Inventory management, no need to, belabor the point around it. Extremely important for accountability, because these are also very high value kind of products. Of course, as pharmacists, we also have to pay attention to the fact that there is a lot of, issues around the legal environment, which helps us to be able to work around availing these products. The policy environment, as we talk about even task shifting, extension of mandates, we really have to see how does the legal policy environment, and more so the regulatory environment, how do they enable us to be able to expand on our scope, even as we try to make sure that we are meeting these this very long list of roles that I have just enumerated. And of course, this is by no means exhaustive. So let's dive in. Number one, our objective as pharmacists, which we really need to take into account, is to ensure that these medicines are available. When you look at the list I showed you, you'll find that in some way, all those functions are trying to point towards ensuring that these medicines are there when they are needed. Number two, although they are available, they should be safe, so that the guys who are taking them, should not die because of the medicine as they are trying to deal with something else, maybe some ailment that they want to treat. So safety, and this also borders on quality, extremely important. But even as we look at now the availability and safety, what people pay most attention to, issues around efficacy. If you look at the list that we had in the first slide, these are the things that we want to identify with as pharmacists. These are our core. When we talk of malaria, these are our core issues that we must make sure we are meeting. And then, of course, the issue around cost. Yes, they're available, but can people afford? So that even if we are saying we have available the best remedy, it is very safe and high quality, and it is efficacious. Can these target clients afford it? So it is also our role to ensure that it is affordable. Now, moving gears a little bit from now that hardcore pharmacy of availability, safety, efficacy, and cost, we also find that now we can stretch it a bit more and get into pharmaceutical care, move away from now just the medicines, making that they are sure that they are available, but looking at other things like, in now the broader scope of treatment, where we have other people coming in, clinicians, providing medicines, providing treatment for our people, using medicines. As pharmacists, we can also come in and be able to now look at the medicines and say, these ones, they have been given in the correct quantity, or maybe incorrect quantity. They've been given too much or too little. It won't work. They've given too much, so it is going to provide, the chances that we'll have adverse events are very high, or you have been given a combination of medicines that are going to interfere with each other. So of course, now we are using our expertise, very unique expertise as pharmacists, to be able to contribute to the care, the overall quality of care by providing pharmaceutical care. That is not the discussion for the day today, but just to tell you that there is a lot that we can do, before we even start venturing out. There's a lot that we can be able to do just within our core mandate. Now, I want us to move another step again, further, and say, now trying to leave our core product behind, which is the medicines. There are many other products that we engage with in our day-to-day activities, which help to contribute towards the outcomes that we want. As pharmacists, we want to alleviate the illnesses, the pain, the suffering. So we find, apart from the medicines, there are other health products and technologies, HPTs, which can also either work together with the medicines or work instead of the medicines to ensure that we are achieving our objective. So now we are becoming goal-oriented, outcome-oriented, so that we say, if I give this patient artemether-lumefantrine combination, they will get well from the malaria. But at the same time, we also say, what is the need? At the end of the day, we want this guy to feel better, to alleviate the problem with malaria. So there are other ways. For example, we can even prevent the malaria from, affecting this gentleman. So there are ways in which we can now be able to say, what is the outcome? A malaria-free situation. We can either wait for the malaria to happen, then we treat, or we can prevent, and there are many ways in which we can do that. Or even this treatment, much as it is involving medicines, there are ways in which we need to deliver it, and there are other things other than these medicines themselves that we need to use so that we can be able to achieve our objectives. And at that juncture, then you start seeing that now, for us to survive, we cannot be boxed into that cocoon of pharmacist, in a small corner, just dispensing medicines and nothing else. We have to also venture out so that we overlap with these other very important functions that are going to enable us to achieve our goal. So health products and technologies, the broader concept. And at this point, I just want us to be able to see what are some of these HPTs. For example, we have the non-pharmaceuticals, the ones that we need to use even as we are delivering our medicines, maybe to protect ourselves in form of gloves, maybe to deliver the medicines in form of syringes, maybe even to help us have better diagnosis so that we can know if we are providing the best pharmaceutical care, like medical equipment. So there are things that we cannot run away from. Now, we are talking today about community pharmacy, which mainly has been dealing with the dispensing. And so I just want us to maybe try and blind ourselves a bit temporarily from the other functions and zero in on dispensing, which we do a lot in the community pharmacy area. You know, we have very many areas. Personally, I am a consultant clinical pharmacist, and that's one of the most enjoyable things that I have ever done. But I remember during my days as a dispensing pharmacist, I really enjoyed interacting with people, providing information, filling prescriptions, you know, sometimes even having to do counter prescribing. And, you know, it was a very interesting thing. So colleagues are doing this every day. And when you go to the community pharmacies, you'll find that, you know, there's a lot of this dispensing happening, either to individuals or to facilities, you know, dispensaries within the area, health facilities, and so on, institutions, schools. So there is a lot going on in terms of dispensing within the community pharmacies. And at this point, I want to take a pause so that we can be able to see when we are engaging as pharmacists in dispensing, it is already a platform. You know, we can look at it as a practice, but at the same time, it now becomes a platform. You know, we have the facilities that can be able to provide certain interventions, you know, a platform for certain interventions that might not be mainstream pharmacy. And that is exactly what we are looking at today. So let's now shift to what we are really talking about in terms of malaria. And I know that during the introduction, we actually were told about the significance of this day with regard to malaria, you know, globally. Malaria, as pharmacists, our first interest would be somebody is already sick, and I've alluded to this before. So what is the best medicine we are going to give? This guy has uncomplicated malaria, so we are going to give artemether-lumefantrine. This guy has severe malaria, so probably we are going to now provide, you know, quinine, you know, second line, or maybe something else, you know, some artesunate-based formulation, depending on the severity of the malaria. So as pharmacists, we would really be in that area. But as I have explained, we would also need to be knowledgeable about the other adjunct approaches that we need to take so that we can get the outcome, which is a malaria-free society. So number one, malaria is a vector-borne disease. And in my public health career, outside of the hospital pharmacy, I have had the opportunity of leading, you know, being the head within the country, the head of the division of vector-borne and neglected tropical diseases. You know, that is one of the most exciting experiences I've ever had, looking at the way in which small insects like mosquitoes can really complicate the whole picture around infections like malaria and others, you know. So as pharmacists, we cannot really just box ourselves into the provision of medicine and be blind to the other factors that are driving the numbers and driving, you know, the bulkiness of the problem, you know, the extent of the problem. We also must be alive to this, you know, general picture and to see how do we plug in so that, you know, we don't get even overwhelmed, because if we just keep on receiving, then we probably are going to get to a point where we have too many cases and we cannot respond. So quickly, you'll find that when it comes to vector control, which is a very important, in fact, to me, I think that is one of the most important interventions when we look at malaria, vector control, then you'll find there are many ways in which we can be able to achieve that. And as pharmacists, it is good for us to know that we can target the vector at the point of breeding so that we can reduce the numbers, the population of vectors within the environment. And this is directly proportional to being able to reduce the disease burden in the community. So we don't really have to use our pharmaceuticals to be able to, you know, address this problem, because we have already mitigated it at the preventive stage. There are other things like even, you know, even if they have breeded, I don't know whether that is English, if they have undergone breeding, and there are so many, we can also intervene and provide fumigation services, reduce the numbers, depopulate these vectors so that we can keep the disease burden down. Internal residual spraying, so that we use long-lasting kind of pesticides which stick on our walls and other surfaces for long, so that as the mosquitoes come into the households and they land on the walls before doing their blood meal, we are able to contain them at that point. So the issue is we are reducing contact between the human and the vector. There are other things like long-lasting insecticide-treated mosquito nets, which we can also be able to utilize. And then repellents, which are also available and can be used to significantly reduce disease burden. We also have other approaches, which there are many, by the way, but there are others which are less useful, but they can find use, especially in areas where the ones that are most convenient cannot be used easily. Like, for example, if we now even encourage community members to put on long dressing, long-sleeved shirts, trousers instead of shorts, to reduce the contact so that these vectors cannot just bite, then that would also contribute towards reducing the disease burden. But we know that most of these approaches have their advantages and disadvantages. We cannot go into that today. But what I just want to maybe point out today is that the ripple effect of these vector control initiatives, today we are talking about malaria, but the ripple effect is unbelievable. And in fact, today, as the head of the National Public Health Institute in Kenya, which is now the direction that the world is taking in terms of public health, I can tell you that this alone becomes one of the silver bullets that we are looking at as health sectors when it comes to mitigating these problems. So what is that ripple effect that I'm talking about? If you can successfully target vector control, then you are looking at not just malaria, but you are looking at other diseases like leishmaniasis, which can actually blow up into epidemics. And we have had those even in our geographies, and many others that we cannot talk about. So apart from the malaria we are talking about today, there are also other benefits that we can be able to accrue from vector control. That is something that we cannot talk about today, because I can see that I really need to move so that we have time for discussion. So let me just now wind up by just going back home so that we can say, yes, I am a pharmacist. I'm trained to deal with medicines, everything that touches on medicines, from manufacturing, all the way to ensuring rational use, safe use of medicines. But we are looking at things like, other issues. And we have just touched on an example of vector control. The platform that we talked about that is provided by our community pharmacy practice becomes an excellent opportunity for us to strategically extend our role within the community, so that we can provide this platform to go beyond our core mandate, which is medicines. This is in a situation where you find that the infrastructure cannot support those other interventions that we are talking about. So we provide this platform to say, okay, fine, we already have a platform here. So all we need is just to bring in the competencies so that we can be able to provide these interventions. And a good example is, for example, something like advocacy, communication, social mobilization, as community pharmacists, we are very, very critical primary healthcare practitioners, providers of primary healthcare, the first point of call within the community, so that when people fall sick, they come to you first. Now, this provides you with an opportunity to be able to talk to them, communicate with them, advocacy, communication, social mobilization, which we abbreviate as SCSM. So this becomes a platform where we can conduct that advocacy, communication, social mobilization, engaging the community so that they can come out in large numbers and be able to benefit from these interventions that are available. Sometimes as pharmacists, we actually engage in corporate social responsibility. And these can be also an extension of our platform so that we can ensure that the communities are taking advantage of the opportunities that are there. For example, the insecticide treated nets that are available in our health facilities, we can be able to provide information, liaise, partner with some of these institutions so that we can make the community members aware of these facilities that are available. Now, when we talk of extension, we can also talk of task shifting, so that you find, even though you have a platform where we can be able to provide diagnostic facilities, we do not have the experts who can be able to provide these facilities. As a health worker, sometimes you'll find that where we are having a complete absence of this expertise, a complete absence of this capacity, then we are called upon to step in and ensure that services are provided, okay? And that is something that, I'll talk about at the very end. When we look at, again, we go back to the legal regulatory framework that I talked about a bit earlier. So task shifting, coupled with the availability of an enabling platform, actually now makes us able to ensure that services such as diagnostic services are available to the community. Even if you have the expertise, you can actually provide the platform so that you have a laboratory person providing diagnostic services. Some of the diagnostic services are very easy. For example, the use of rapid diagnostic test kits. Those are some things which do not need a very highly skilled person to do, and they can actually be provided under the task shifting framework. Now, there is a whole list of services that can be provided either under the strategic extension framework or the task shifting framework, which can now result in the pharmacist being a much more useful person, a much more useful public health practitioner within the community. And what we are talking about is we have to really look at these partnerships, with other cadres, with existing institutions, so that we can be able to ensure that these services are available to everyone. So, direct provision of scarce services. I've just said, where we don't have the expertise completely, you are not going to sit there and watch as people are dying because you are not a medical officer. You will definitely look for ways in which you can plug in so that these services can be made available. And then, of course, I think as a community of pharmacists, it is important that we also look at the possibility of updating our legal framework, our regulatory framework constantly, so that it can be alive and flexible to the changing needs of the society, so that we can be much more useful even as we move forward. Now, I had planned to just make a brief presentation for 30 minutes so that we can have a little bit of time to discuss. I know that we have eaten into the Q&A session because we also started a bit late. But at this juncture, I think I would like to take it back, to the session chair so that we can now transition into the Q&A / discussion session. Thank you very much, and back to you.
Thank you so much, Dr. Sultani. That's a very enlightening session. I think we can all agree that Dr. Matendechero is calling us to be very proactive pharmacists. I mean, if you're not proactive, you won't be able to identify the loopholes in the community that will enable you to curb malaria or provide the right medications for our patients. So I'll invite the audience to type in your questions in the chat box. In the meantime, I'd ask Dr. Matendechero to just briefly emphasize again on the need for a community pharmacist to participate in community engagement in terms of vector control, diagnostic testing, both in terms of their close family members, the importance as close family members, and how much it will contribute to a community pharmacy as a business setup. Yeah.
Yeah, I hope that I have understood your question. And I think sometimes when we work as, public health practitioners, providers of healthcare services, many times it is not about providing services for a return, especially monetary return. Sometimes it is more of, adding value to our core mandate, so that we kind of like even improve our outcomes. Remember, when we were talking, I talked of what is the outcome? What do we expect to achieve at the end of the day as we are giving these patients the medicines? What do we want to achieve? And this outcome-based kind of approach will tell you that even if you now say you just want to stick to the pharmaceutical component, providing the medicines only, then you'll find that your outcomes will not be as good as if you also try to ensure that you have moved some of the other interventions so that you can be able to provide them more effectively. So sometimes it is just about also ensuring that the whole continuum in terms of delivery of services is taken care of. So as a community pharmacist, a pharmacist or working in a community pharmacy, this is now something that you can do at family level, at friends level, at personal, interpersonal engagement level. But it is also something that you can do even within your space of practice, like as an extra, an add-on service, to your community, your core community practice, which is now to provide or to dispense medicine, to fill prescriptions, and so on. So generally, it is something that, we need to embrace even more, either through providing the platform so that you work in partnership with other cadres, or by even doing it yourself where it is completely absent. There is no way you can be able to get that service. You have to step in. You are a healthcare practitioner, for God's sake. Even if your training was just in medicines, but it has exposed you to many other competencies within healthcare provision. So you need to be ingenious enough to be able to provide some of these services. We are not saying that now, as a pharmacist, you go and you start competing with the clinicians to maybe help people to give birth, and things like that. You are kind of setting up a practice where already there are other people who have clinics. No, but we are saying that where something is needed, there is a dire need, and you are a healthcare professional, then you need to actually be able to step in. And even if it is not to plug the gap as you try to move towards where this person will be assisted, you need to have some competencies to be able to do it. And some simple things like vector control, advocacy, communication, and social mobilization. Such things, really, we need to have the ability to provide such services. Thank you, and back to you.
Okay, thank you so much. In your opinion, and your experience in public health, would you please highlight for us at least one stronghold that the community pharmacists have been doing that has contributed highly in vector control, and a weak point which will serve as a loophole for us to look into as we continue practicing, so that we improve the outcomes in terms of vector control and community engagement?
Yeah, so of course, in my practice, I would say that at some point we have really tried to drive uptake of, the use of long-lasting insecticide-treated mosquito nets. And at some point, we have seen community pharmacies as a good point in which pharmacists, can participate in educating the community about the need, the presence of these important supplies like mosquito nets, the need for them to be accessed. Some of them are not even aware. But better still, also to even provide information about the correct use of such, supplies like mosquito nets. Some guys will go and hang them in their houses, and they don't use them to cover. Some will go and try to use them, then they start dreaming that they are, because they are white and they are box-like, maybe there are things that are supposed to be used for funerals, so they believe that maybe they start having nightmares that they've died and things like that. So we can have our people kind of intervening to tell them, no, you just dispel those issues and try to engage them. When we were talking of advocacy communication, those are areas that pharmacists can do very well. But at the same time, also even actual provision of such supplies. Now, apart from mosquito nets, I talked of things like repellents. Pharmacists are excellent outlets for those kind of, supplies. So you'll find that there is a big opportunity for us, because these are supplies that are even sold in supermarkets. So as pharmacists, especially given that these are supplies that are going to directly impact on reduction of the disease burden, then it would be an excellent place for us to also be able to provide this service. I hope I've been able to speak to the issue that you had raised. Thank you.
Yes, you have. Yes, you have. I think as pharmacists, as we receive the patients who have been diagnosed with malaria, or if you are doing the diagnostic tests in your pharmacy, you should also take time to explain to the patients on ways of reducing, of curbing enhancing vector control. As he has said, explain to them the importance of using mosquito nets and repellents, and these are the things that will reduce the spread of malaria. So I'll go back to the questions in the chat box. Emily Babu asks, what happened to the insecticide repellent tablets that used to be available for treatment of mosquito nets?
Yeah, so I think that's a very good question, because this is something that I really enjoyed dealing with when I was the head of the division of Vector-Borne and neglected tropical diseases, trying to ramp up the use of mosquito nets. So previously, we came up with there were some nets which were not treated, and you would have to treat them manually at home. You get tablets which you can use to treat the nets with, kind of dissolve in water, use them to treat the nets. And then after some time, again, you do the same. But we realized that this was not very effective, because those untreated nets, if you don't treat them as frequently as you need, or if you don't use the correct concentration, there were too many factors that were bringing an ineffective result. So you find, although yes, you have slept under a net, but your hand is next to the net, and a mosquito comes and lands at the place where your hand is next to the net, they still bite you, because the net does not have the insecticide. But now we started moving towards the long-lasting, and I think when I talked about then I talked about the long-lasting insecticide treated nets, the LLITN. So those ones you find, they come from the factory, they have been treated, and the technology that has been used is such that you don't need to retreat them, in a very long time, some of them even up to more than 5 years. By the time you're now thinking of treating them, they are already torn, and, so it is not even a net that you will now talk of retreating. And that has kind of like now rendered these tablets that we were using for treatment, it has rendered them redundant. So technology is also really moving us forward, and you'll find that some of these are, approaches that we were using before, they are no longer necessary. We have better ways of being able to do it. Thank you.
Thank you. Tayebo asks, how can pharmaceutical scientists actively be part of this call?
I don't know whether I understand the question, but probably what I have really been saying is that let us not stay in our corner there in the hospital or in the community pharmacy, just dispensing, reading, the prescriptions, and just, doing just remaining around the dispensing. That is a very big waste of our, I know that is an area that is our area. And there are many other core areas that we have not yet explored. But at the same time, it is also good to blend into the general field. I think for the last 12 years, personally, I have been working in public health. I have not dispensed a tablet for more than 10 years. I have worked, I really enjoy doing clinical pharmacy work. So I go into the wards, I see patients, I look at their regimens, I look at the duplication and things like that. But today, I think for the last 7 years, I have been designing public health programs. I have been designing public health interventions at a country scale, mass treatment, preventive measures, health promotion, things which might not be mainstream pharmacy. So what I want to encourage is that as pharmacists, let's not feel that we are restricted to the medicine, the drug. Let us also know that we are health workers. At the end of the day, yes, that is our expertise, but we can still also go out. So whether it is vector control, whether it is diagnosis, whether so long as it's a health area, and there's a need, we don't really go in to start competing with the experts. If they are there, let's partner, let's provide a platform, let's make it better. But where there's a need, let's also be able to step in. And I think as pharmacists or pharmaceutical scientists, as you call it, we should be much more useful if we can be able to be a little bit more versatile than just sticking to the product. Thank you.
Okay, thank you. Emily asked, some years back, we had public health officers moving around, spraying drainages and swampy areas for vector control. I believe that being in a community pharmacy, one could be willing to participate and engage members of the public in doing so. So she's asking how community pharmacists can participate in such initiatives.
Yeah, there are many ways actually that, you can be useful in that kind of important preventive measure. Number one, I talked of CSR, as some pharmacies actually really grow and they become corporate entities within the community. And we like giving back, to the community. So you can support maybe, and that one we call it destruction of breeding sites, if you remember in the presentation. So you can provide the resources that will enable to get, those pesticides that are going to be sprayed, the knapsack sprayers, maybe providing some resources for the people who are going out there to spray and things like that. Now you can also stock those, the pesticides that are being used in the spraying. At the same time, you also can provide communication. You can also engage in advocacy so that you encourage the community members, even at their own household level or within a small area of the community. They can also come up with that initiative. Even if they are not being supported, they can also come up themselves and be proactive enough to conduct this kind of a destruction of breeding sites. So as a trusted and respected healthcare professional within the community, whose word is also really taken as it is with a lot of confidence, then you can also add your voice to ensuring that the community is also proactive when it comes to destruction of breeding sites. So as community members, and also even as the health workers, like the public health officers, as a pharmacist, you can also participate in it. And remember, always keep on remembering that you are better off looking at the outcome. So that sometimes, some people who, for lack of a better word, are not very sharp, might say, okay, let's have lots of cases of malaria from the community so that they come and buy the AL from my pharmacy. That is a very myopic way of thinking. If you think about it in terms of the outcome, where you're saying we want a malaria-free society, then believe you me, you will find that there is much more for you as a practitioner, rather than saying that let's have the cases going up. So if you really participate closely in ensuring that the preventive measures, the health promotion measures are being undertaken, then you'll just be able to see. There'll be much more for you to do, and there'll be even much more returns, much as you're not looking at the returns as your goal.
Okay, thank you. So the question on vaccines being rolled out and the role of community pharmacies will be addressed in tomorrow's webinar session on innovation and advances in diagnosis of malaria and treatment. So I'll close up this session with one final question. So are there ways that MOH and the Department of Malaria Control support community pharmacies to be involved in malaria control programs?
So I think I wouldn't really say that there is a very specific provision for that, but at the same time, there is no barrier, And generally what we are looking at, my very last statement in my presentation was that we really need to also introspect as pharmacists. And I think this is something that I really encourage, not just, I think Kenya has proved to be a trailblazer in a lot of innovative ways of dealing with things. So our regulatory bodies, and this is a discussion we are even having now within our society as pharmacists. And I hope that everyone here is a member of the Pharmaceutical Society of Kenya, because we really need to come together and think and support our society so that it can also make us more focused and more productive. We are discussing about having more robust legal and regulatory frameworks, so that, what we are doing can be anchored within the law. It can be regulated. We look at better ways, more innovative ways of, regulating the practice. And we provide policy direction. We provide legal frameworks, which can be able to explain, to provide for some of these things that you're asking about, even if it is not to that detail, but it is generally provided for. So that way, even as a ministry, we wouldn't really now have to come and tell pharmacists, okay, come and participate in malaria prevention. It would be something that is even taught in the colleges, something that is practiced. And as a ministry, I don't think it is there is any problem. So for as long as there is a well-regulated provision for pharmacists to engage in in strategic extension of the interventions that we are providing, or in structured task shifting, then that is something that is already provided for. So I think for me, it is actually, the ball is in the court of the pharmacists to be able to come up with that enabling environment.
Okay, thank you so much. So this has been a very enlightening session. Thank you for gracing this webinar. We are very grateful for your insights and inputs. We hope to interact further through any platforms that we will create to enable malaria control and provide bigger opportunities for community pharmacists to participate in this movement. So at this point, I'd like to welcome Dr. Kanyi of HOPAC to give them a chance to say a word or two, since we are in partnership with them. So thank you. Just before Dr. Kanyi speaks, if you have missed bits of this session, you will be able to access the recording on the African Pharmaceutical Network's YouTube channel, and then we'll give you a feedback at the end of the webinar series to help improve our programming. And remember that a certificate of participation will be provided to all the participants. So welcome, Dr. Kanyi.
Thank you so much for this opportunity. And I don't have much to say. I just want to sincerely appreciate Dr. Sultani.
Dr. Kanyi, you're on mute. Dr. Kanyi, you're on mute.
Hello, can you hear me?
Yes, now we can hear you.
Oh, sorry. I just wanted to sincerely thank our presenter, Dr. Sultani Matendechero, for the enlightening session that we have had, and for challenging us as pharmacists on how we can be more engaged in primary care, especially in the area of malaria control and specifically vector control. Thank you for even being sort of a mentor and breaking the ceiling, and as one of the pharmacists who has been involved in public health activities in the ministry. And we thank you for agreeing or participating and facilitating this session. I hope us as pharmacists, we have learned on areas that we can be more engaged, regardless of the area that we are working in, that we can all make an impact in primary healthcare, and especially malaria control. I also want to thank our partners, African Pharmaceutical Network, for facilitating this session and the coming session that we'll be having tomorrow and the day after. Thank you for working with us, and we hope to be more involved. I challenge every pharmacist who has been part of this webinar to introspect and even look at areas that we can be more engaged in addition to providing medicines, as Dr. Sultani has said. How can we be more engaged in community activities that impact on the society? So I want to thank every pharmacist who took their time to attend this session. Please attend the session that is coming tomorrow and the day after, and so that we can be more enlightened on how we can be participating in this session and these activities in our community. So again, thank you, Dr. Sultani. Thank you, African Pharmaceutical Network. Thank you, the CPD team for facilitating this. And may you have a good evening from this end. Thank you.
Thank you, Dr. Kanyi. So now I'll welcome Dr. Diambo to close up the session.
Fantastic. Thank you so much. Thank you so much, Kelly. Thank you, everyone. Dr. Sultani, that was wonderful. I really appreciate and thank you for the support and the insightful commentary that you've shared in terms of the presentation. And the most critical bit for us from Africa Pharmaceutical Network is to acknowledge that there's a lot that we can do. But for us to do it, we have to make the initial commitment and look at what is the impact of the work we want to achieve. Then from the impact perspective, what are the specific outcomes that we need to achieve? And if we focus on that, we'll be able to create value and actually realize that the value of what we're doing is going to be substantial. As Dr. Sultani has mentioned, you might be looking at the financial imperative at the initial sale of just medicines. But what you've not asked yourself is, what would be the additional revenue streams that you'd be getting if you designed it as a program and actually positioned your community pharmacy as a platform, but not only as a shop where you just sell products. So those are key things that we need to look into. And two, thank you so much for those who've joined and contributed. I know we have John Mark, even from Uganda. We have a couple of colleagues from other countries across. Thank you for being part of the conversations and engaging with us. I hope we'll make these as insightful as possible. And then finally, as I get towards the last remark that I'm making now, we've indicated that we have two more sessions to come. There were three-part webinar series. So tomorrow we'll be having Dr. James Kimodo, who will be presenting on innovation and advances in community pharmacy practice with focus on malaria management. And those are some of the people leading robust research in rapid diagnostic kits and malaria diagnosis in Kenya, across Africa. Even for the vaccine, when you're talking about vaccines, the vaccine trial that were conducted in Kenya was led by the team from the Innovation Hub from Cambridge. So feel free to engage tomorrow. Let's learn and see how we can make those advances contribute. And finally, I'll give you a chance to give your final remark, Dr. Sultani, as we keep on the conversation. Thank you.
Yeah, so thank you very much. I think for me, nothing much, just to encourage everyone, let's keep on engaging, let's keep on sharing, let's keep on applying, better ways of doing things. Let's keep on improving on our contribution towards trying to achieve the highest standard of health for every Kenyan. So thank you for inviting me to this. As I told you, this is a crazy week for me, but I wouldn't have missed this for anything. So I believe that it has been useful, and I hope that we can keep on growing and growing as pharmacists. I'm a very proud pharmacist, and I think as Kenyans, we have also showcased that pharmacists are very important in the healthcare sector. We are at the table, squarely so. And we are proud of being very important members of the healthcare provision team. So thank you, everyone, and all the best. Back to you.
Thank you so much, and thank you, everyone. Thank you, Kelly, for the wonderful moderation. Have a good night, everyone. Thank you.